Why not? I know you guys always love the recordings later. All right, so welcome everybody to my 30-minute weekly learning bites. We do this every Tuesday and Thursday, hot topics in healthcare supply chain from our healthcare supply chain hub here at the Bridge. And I'm Angelique Beslick, and it's so good to see all you guys. And we are recording, and we're going to get rocking and rolling here. Today, we're jumping into rebates because I feel we are leaving rebate money on the table. It happens to me every day where I work currently, and I feel that we need a no nonsense playbook. And I'm about to give it to you guys today for rebates. So I'm super duper excited to share this with you. Now, there's a ton of info today. So I'm going to fly through it in hopes to have Q&A at the end. Okay. So let's jump in. Why rebates matter. Okay. And where the money is hiding. We need to really understand that. So that's why we're going to start with that kind of in the agenda. And then we're going to jump into types of rebates, key contract terms to capture. I'm going to talk a little bit about, we were talking last week about data plumbing, setup, tracking, accruals, how to set up the data and how that plumbing structure works. We're going to go into monthly reconciliation and dispute workflow. We're going to go into compliance and controls and how to do it right around rebates. And then we're going to jump into KPIs. Of course, we have to measure for success, and a 1-day massive action plan, which you guys always get at the end of all my learning bites via email. So this is going to be really hearty. Some key takeaways today. If you don't set up rebates on day one of your contract correctly, you're going to chase those dollars on day 120 of that contract. So I really want you guys to realize that the contract terms need to go into this workflow, ERP fields, your monthly accrual to cash. And you know, your ERP actually connects supply chain with finance. It's the perfect opportunity. So you miss one of those connection points, you lose money. Tier leakage is real. You need to map your SKUs within your item master file, your unit of measures. We get leakage because we forgot to buy the wrong unit of measure. The ship to is important. The membership roster has to be precise. And these are the reasons why we are getting leakage in our rebates. So your dashboard should show eligible spend, your tier status, your accruals, and credits received. And literally, compliance in this isn't optional. So you need to be documenting, reporting, and passing through discounts as required. Suppliers on the call, same thing for you. I want you to be strategic partners with your customers. You should be talking about your rebates that you're offering through your contract. You should be talking about them often. That is what a strategic partner does. And that is what I want all of you suppliers who are learning from me today on the call. All right, so let's jump into it. Rebates, what they are and what they are not, right? So a rebate on the healthcare supply chain side, and honestly, many different areas, retail, manufacturing, they all have rebates somehow, somewhere. Hey, you are a consumer. You also probably get rebates from things you buy for your house. But from a healthcare supply chain standpoint, it is a post-purchase, so after purchase incentive that is paid as a credit, cash based on agreed performance of some sort, right? So there probably some kind of contract term that tells you you have to do this as a customer and you get this after purchase. It is calculated on eligible SKUs, items, spend over a defined period, whether that's monthly, quarterly, annually, really kind of just depends on your relationship with that vendor or that supplier. Rebates are not guaranteed savings, only realized if eligibility rules are met. You can put this on your savings tracker, and I do, but I make sure through my team that we realize it and we actually have got that money. Because from a health system standpoint, you should not be claiming that as savings until the cash is in your hand. It is also not a set it and forget it. They require disciplined tracking and reconciliation on a regular basis. If you do not have someone assigned to manage your rebates in your health system, you're losing out. Okay. So, common rebate structures. I want to make sure everybody realizes these. There's a volume and a tier rebate structure where high tiers at higher spend and higher unit volumes, right, of your items that you're purchasing. Know if your tiers are cumulative or marginal. You really need to understand, like, hey, is this, I have to reach this volume to get this tier? Or do I need to just be within the tier somewhere and I'm good to go, even if I'm at the lowest point of the tier? You need to be very clear if you get a rebate, if you're at the lowest end of the tier, the highest end of the tier, somewhere in between in the tier. And those are the things that you need to really understand. That's all part of your contract language. There are growth rebate structures, incentives that are based on year over year growth versus just a baseline. So if I was just doing it based on tier volume, that's probably just a baseline and I can squeeze by, right? But year over year growth is actually asking me as a customer to buy more of that product or that product category year over year. And then I will be incentivized within a rebate for that growth. Now, I always tell my vendors sometimes that, how do I get growth? I hope more people are sick. I hope that I use more of your product. Maybe I take my car and I go run over people to bring people into the hospital. It doesn't sound very good. But if you are growing in your community and more patients are coming to you instead of your competitor, that's obviously how you get growth, especially if you have sole sourced that vendor, right? If you're already giving them all your spend, I don't know how you get more growth unless you do some of those activities. There's the market share and compliance rebate. It is a reward for a percentage share or formulary adherence across the category. So if I say I'm going to give vendor X 80% of my market share for that product category, then I get my rebate. If I slip down to even 79%, I don't get my rebate, right? So you have to adhere to that formulary and that promise of that commitment. There's prompt pay and early payment rebates, credits for paying within the tight terms. Maybe they say you have to pay within 10 days, pay within 15 days, pay within net 30. You could get a rebate. There's freight and logistics allowances, maybe credits tied to shipping methods, volumes. Maybe they want you to ship ground and they say, hey, within a month period or a quarter period, if you don't ship anything overnight, meaning you know how to manage your inventory, they will give you a rebate. Hey, that sounds good, right? And then there's performance base. So thinking about quality, patient outcomes, a service metric or a key performance indicator of some kind. These are less common, and you have to document the evidence of this. However, I'm going to tell you, any of you guys are taking my certification program, you'll know I continue to talk about value-based care. Performance-based really ties to value-based care and value-based contracting, and really having a risk-reward model with your suppliers, with your vendors for outcomes of your patients, reimbursement to your different case types. So that's actually a good one, and it's up and coming as CMS rules are changing. So where the rebates live, okay? So you think about your contract source. You've got your GPO, prime vendor agreements, national and affiliate contracts, right? Then you have your local agreements. That's where the health system is just negotiating directly with the vendor or supplier and or with the between the provider and the manufacturer, however that looks. Those are local agreements. And then you have your distributor programs. You've got chargeback, growth, tier, tier adders. Those are your distribution agreements. So you've got three of your contract types, and you could get rebates from any of those three types. Then you have your systems and your portals. So you've got your GPO portal. Everyone has a login to their GPO dashboard, your vendor portals, and you can see your earning statements. You actually want to make sure whatever GPO you're with, whether it's Premier, Vizient, Capstone, Yankee Alliance, wherever you guys are at, make sure you can log in and see your earnings. Then you have your ERP system, right? Workday, Infor PeopleSoft, Oracle, and you have your accounts payable within that, right? Because remember, ERP is supply chain finance, and you most usually HR or people and culture functions. You should be able to see, right, in your general ledger, that's what GL is, for your accruals and your settlements. You should be accruing for those rebates in that system and in that portal. And then with your distributor, right, there are your sales reports that go through distributor, your chargeback reports, and you should be able to get that since your distributor is your integrated supplier. They're not just a strategic supplier, they are an integrated supplier. They are at the table in your management meetings every week, maybe even in your huddle every day. You should be able to just say, hey, I need my rebate report, and they should be able to print that on will. Okay. So this is where the rebates live and where you can see visibility of them. You should take the initiative to ask. If you are a supplier, a distributor, or a GPO on this call, you should take the initiative to offer this to your customers. Okay. All right. So rebate setup checklist. I want you, if you're doing this for the first time, and I will say, and you probably have heard me in my certification program, vendors kind of like rebates. No offense, suppliers and vendors, because it's something that they know is forgotten on the customer side, and that they know, oh, they'll forget about it and they won't come after it. And I wonder, supplier by supplier, how much money sits in accrual for rebates that's never claimed. I would love to see what that number looks like. But we need to make sure we're setting it up right on the health system side. You've got to have a mechanism to capture the rebate, the contract number, the effective and the expiring dates of that contract. What are the item numbers, the SKU numbers, whatever they're called. You can use the manufacturer item number and your ERP system item number. The eligible ship tos, make sure you're getting that from your contract, because if you accidentally left the ship to out, that is your fault and you're not going to get a rebate for that ship to. And then who your distributor of record is. Make sure you're capturing this data. You're going to want to map the unit of measure for that item and the price basis, whether that's case, each, pack, roll, whatever that is, that unit of measure, and you want to convert it consistently. So if you're running a rebate spreadsheet, you can just make sure everything's in case, but you're going to convert your price based on that, so that if I am Skippy and I'm an analyst in the informatics analytics team, I don't have to go and chase the contract and figure out, well, is it in each? Well, is it in pack? If you guys just keep consistency in your spreadsheet or your tracking device, that everything's just converted to case, it makes it easy for that person who's assigned management of your rebates. You want to define your measurement period your baseline and the tier logic, whether it's cumulative or marginal. Am I accumulating it also over a year, over the 3 years of the contract? Am I really understanding that it is from this bottom of the tier in between the top end of the tier or somewhere in the middle? You've got to make sure that you're understanding your rules of the contract language. And then you want to enter your fields in your ERP system or your contract module or wherever you are housing your rebates, and you want to flag them rebate eligible SKUs, right? Because then every time you do a purchase order for those SKUs, it somehow is capturing that. Now, people have said to me, Angelique, my ERP system does not have this available. Well, I'm sorry to say you're going to have to do that in a manual Excel spreadsheet then. Okay. Unfortunately, and a lot of health systems, the ERP system does not do this and doesn't do it well. I do know that there are some emerging companies out there that are doing rebate management. GHX's is doing it now. There's some other companies out there doing it. I believe SpendMen does it and some other places. Go look, do some demos, figure out where the best place to do this is. Then you want to build your accrual codes and your general ledger mapping with finance, because you want to define your true up, we're going to call your true up cadence with finance, and make sure that finance always knows that, hey, when I see the spreadsheet or I see it in our ERP, I know I'm supposed to be waiting for those checks, and I should be meeting with supply chain on a quarterly basis just to true that all up. That is kind of what you want to be doing, is meeting with your finance team regularly to make sure, have you received checks? Where are we at? Do you need me to chase the supplier or the vendor for the checks? And making sure supply chain is being like the facilitator of that conversation. And then you want to confirm the evidence. That could be through your EDI process, through Vizient or GHX, whether it's your invoice, your 867, your distributor data. What's going to validate it? And honestly, a lot of times I just send an email to the vendor or the distributor and say, hey, it is rebate validation time. It's the end of the quarter. Can you send me your report? I'll then match it up against my report and my invoices, and I'll validate it, right? Suppliers, please help your customers through this process. It's tedious, it's manual, and you would be a great strategic partner if you did that. So just remember, supply chain has to work with their finance team to do this, and it's a lot of work outside what I would say the normal everyday daily tasks. So suppliers, if you can help, it would be great. So when I talk about this whole data plumbing, I want you to think about some essentials. Golden keys, your contract number, manufacturer item number, our item number, if your ERP system has assigned a different item number, unit of measure, if there's a distributor reference number, location, ship to, all those rosters have to be in line. Then you want to think about membership roster hygiene, right? You want to keep your GPO affiliate rosters current, your ship to rosters current. All those things are very important. You want price integrity. This is all where I keep saying data is king. Data must be clean. You want to sync your price files, your 832 price files, lock it to active tiers, right? If this is going through GPO, you want to make sure that your price file is clean, especially tied to your unit of measure. And you want to have transaction visibility. I talk about four-way match in your procure to pay process all the time. 850, 855, 856, 810. That is your PO to PO confirmation, to your advanced shipping notification, to your invoice in your procure to pay process. You want to add in your 867, which is your equivalent resale data when it's available. And, sometimes GHX or Vizient, they're going to charge extra for that. transaction, but if you have enough rebates, it's worth it. If you don't, then don't pay for it. But thinking about maybe creating a single rebate master table to drive your dashboards and your accruals so that this Excel spreadsheet doesn't seem so manual. I think that that's super important. So tracking an accrual model, you want your eligible spend to equal your invoice dollar for your rebate eligible SKUs within that period. So if it's a month or a quarter or a year, then you're going to have your accrual, and that equals your eligible spend times your rebate percentage by tier. And for tiered thresholds, you want to specify your cumulative versus marginal and then handle resets or quarter to date carry. And literally I look at it from a fiscal year carry, right? So if my contract started January 1st, awesome, that seems easy. But if my contract started May 1st, and that's in the middle of a fiscal quarter for me, you've got this strange carryover from a finance standpoint. So you're really going to have to figure out how you're going to handle, what those thresholds look like. Then you want to have your dashboard fields. If you're doing a dashboard or if you're doing an Excel, your spend year to date, quarter to date, your number of units, your tier achieved, your next tier gap, right? Because you are always trying to fish to get to the next tier. Your accruals booked versus credits received, that you get from finance, right? Because finance is going to tell you if they received those rebate checks or if they're being sent to you in credits, right? And your variances and aging meaning how many days late that accrual is. And then your top 10 SKUs, suppliers driving rebates, and then dollars that are at risk, because you want to make sure, what am I missing? How much money is it? What do I need to go chase and remind the suppliers that they owe me money? So those things are very important. So when I think about, here's an example of this. Okay, this is a tiered rebate calculation. It's a quarterly tier. My tier is spend from 0 to $999,999 is 0%. If my spend is between 100,000 to 249,000, I get 2%. If I have over 250,000, there's 4%. This is marginal calculation, okay? So if my quarter to date eligible spend is $260,000, my accrual should be the $100,000 times 0 plus 150,000 times 2% plus my 10,000 times 4%. Do you see how that's happening there? This is a tiered rebate structure. So I'm getting 4 different rebate structures for my $260,000. It's not just a simple $260,000 worth of spend. I would assume I get 4%. This is a marginal rebate, not cumulative. Cumulative, it would be I just get 4% on the whole 260,000. So that's how this is calculated out. That's why I wanted to give you a marginal example, okay? You want to document the math in your model and never assume that the vendor's interpretation matches yours. And that is why you need to meet on a regular basis with your vendor to make sure how you're interpreting the calculation matches how they are interpreting it, okay? Very, very important. So this monthly reconciliation and dispute workflow. At the close of every month, book your accruals, tie it to your general ledger, have snapshot tier status. Pull your vendor statements, match your credits to your accruals, see what they're saying that they paid you, investigate the deltas, unit of measure mismatches, ship to misalignments, missing membership. That happens a lot, especially on the GPO side. Oh my gosh, you forgot that I was a member of that and I participate in that agreement. Price files, and then log your disputes with evidence owner, due date, and then escalate per your service levels, whether you're escalating to the contracts administrator in strategic sourcing and contracting, to the vendor, whoever your escalation pathway is. And then you want to true up your accruals quarterly, retire your expired programs right away so they fall off of your reconciliation spreadsheet. You don't want rebates on your reconciliation spreadsheet that are no longer live or active, okay? Roles, responsibilities, and controls. RACI is more your roles and responsibilities, but it's really dictating who is responsible for what. So supply chain and the contracts team, they own the setup, eligibility mapping, and the vendor communications of the contract. Okay. The analytics teams build the item master, the rebate master. They do the accrual model, they do the dashboard, they do the alerts because they're the data people, right? Your AP and finance do your general ledger mapping, your accruals, your credit posting, your cash application. They apply the cash where it needs to go. Your compliance and legal teams review the terms against your policies, maintain the documentation. Internal audit then can do periodic sampling of the accrual accuracy, evidence on file. They might take one rebate and walk it through a year's worth of payment just to make sure you guys have everything set up right. But this is roles and responsibilities by department. I want you to have compliance and documentation. Maintain a central repository for your contracts, amendments, eligibility rules, your evidence reports. Hopefully, you do that today in your ERP system. Reflect your discounts and your rebates appropriately in financial reporting and cost reports. You must accrue for those things, they should be on your financial books. And ensure pass-through requirements are met per payer and government rules, because if we don't get finance involved to take a look at that, we're going to have some problems. You want to avoid tying rebates to inappropriate referrals or volume incentives. So you want to seek legal review as needed, because I don't want to be getting a rebate under a table as a secret handshake for something I'm doing. Going out to dinners with reps or something, I get a rebate. You don't want any misappropriate incentives. And if it's not documented, it didn't happen. So save the receipts literally. You've got to document everything. So some KPIs and alerts. You want your rebate capture rate equaling your credits received divided by your expected accruals. Your target should be, greater than 85%. You want your accrual accuracy and average days to cash in your KPIs. I want you guys to be watching for your tier leakage dollars and your top root causes. Usually unit of measure, ship to is wrong, membership's not hooked up on your GPO side. Usually something's not connected or something's not right. Suppliers, please help your customers with this. Meet on a monthly basis to make sure there are no leaks. You want to have open disputes, your count, and your aging and your win rate. Like if I am always collecting 100% of my rebates, that's a 100% win, right? Percentage of programs reviewed, renewed before expiry. Remember, in Finance 101, we can always claim those savings if they're new. Okay. So massive action. I want you guys to do this tomorrow, and I'm going to give you guys a checklist as always. But pull your past 12 months of spend for your top 10 suppliers. Identify your rebate eligible SKUs. Hopefully, there's some rebate terms in there. I want you to build version 1 of your rebate master, whether it's a spreadsheet or you're going to do it in your ERP system. And I want you to calculate your quarter to date accruals for one or two of those suppliers. And I want you to compare to credits received. You're just trying to validate. I want you to see how it works. I want you to create a dispute log template Open tickets on mismatches with evidence and figure out who is going to be the owner to resolve those, and schedule a 30-minute monthly rebates huddle with your contracts team, your AP team, your analytics team. That is the super simplest thing to do tomorrow if you want to start getting your rebates in check. Okay. Some common pitfalls. We talked about this already. Unit of measure off, each versus case, and you need to test that, right? Membership rosters out of date. Assign an owner, have a weekly sync with your GPO. Distributor of record may be misaligned. You want to confirm on your setup and monitor that quarterly. Your tier resets may not be understood. So codifying if it's cumulative, marginal in the model, and you want to make sure the way you're defining that rebate is the same way that the vendor is. And then you want to look at expired programs that you still think you're accruing for, and you want to end those right away, and make sure that they're not causing some of the errors you guys are seeing. Okay, so final thoughts. Pick 2 suppliers and stand up this tracking this week. If you guys want my templates, I'm going to be sending them to you, and I will get those out to you along with this PowerPoint. But if you have any questions, I want you to reach out, because rebates are really deep. They're very, very thought and time consuming. So I want you guys to be able to see that. So the other thing that I want to make sure is that you guys are getting my emails at the end of these learning bites. They might be in your spam, but please mark us safe so that you get these tools for free that I send you guys at the end of these learning bites, because I want to make sure you're getting them. So I see some of you on my learning bites every single Tuesday and Thursday. Let me know if this stuff is ending up in your spam, because I want you guys to mark me as a safe person to send you guys emails. Okay. And if you guys should be getting emails from Angelique at healthcaresupplychainhub.com. But if you guys have any questions, just reach out to our customer service team as well. So there we are. Does anybody have any questions about rebates real quick that you guys want to share? Anything? Come off mute. Nothing? You guys are handling your rebates awesome, or somebody else is handling it. Maybe Angelique is handling it. All right. Well, good to see you guys. I hope you guys have a great rest of your evening. And if you need anything, you guys know how to get a hold of me, and watch for my email with this follow-up. All right. Everybody have a great evening. We'll see you soon.